Okay, so welcome once again.
Yeah, welcome.
You are coming from Oman.
Oman.
Yeah, nice to meet you. I really, it's my first time from a patient from Oman, and I like the country very much. I am very, I wonder. I've been in Muscat once. I want to go
I
there
recommend
more.
you to come here.
Yeah, it's really everyone from Umman. For Varicocele, it's my first time, but I had other patients. They tell me it's very interesting country. I love this culture. So now, how many days now after the operation?
4 days.
4 days.
Yes.
And you now I looked your testicle to see if the blood is coming nicely. The blood vessels circulation is normal in the testicle. And please tell me your story. You had an operation before, right?
Yeah, unfortunately I have 2 years before
Yeah.
a microsurgery
Yeah.
on my left testicle. But actually after the varicocele operation, 2 months, the vein is not disappear.
You feel that it is still there?
Immediately after the surgery, I feel it.
Yes.
And I go to the doctor, urology doctor. Actually, I choose the best doctor in my country. Yes. You know, this varicoceles need very sensitive operation.
Yes.
And he told me wait for 3 months.
Yes.
I wait for 3 months. 6 months, I go for another radiology doctor.
Yeah.
He make ultrasound. He say you have a recurrence. You have
recurrence.
what?
Actually, it is not recurrence. It is persistence.
Persistence.
The varicose vein was there. It didn't disappear and come back. It was there after the surgery. It didn't disappear. So it is persistent vein.
Okay.
But nobody knows. They because they don't understand. They say, "Oh, new vessel formed." Not new vessel. It is the old vessel staying there. So then, did you have any pain issue problem with the this vein?
Before?
No. After the surgery, you felt that the vein is still there, and it is caused any pain? How
no
was
pain.
it?
Actually, the vein is no pain after surgery, but actually the veins, it's visible from outside.
Yes.
Little shrink.
Yes.
Little shrink.
Little shrinkage.
Little shrink. Yes. And after 1 year, I go to the radiology. He say it is the reflux.
Started.
Yes, reflux starting, and he recommend to do surgery. I say it is. I don't need to repeat this surgery. I found like new techniques. He recommend to the embolizations. Embolization, but I listen your.
Was he doing embolization in your country?
Yeah. It is a lot of country do embolization, but then.
And this radiologist, was he doing that?
No. Another. He recommend another doctor.
Okay. Because interventional radiologists, some of the radiologists do it, some of them not. But the problem is embolization cannot reach the external vein. You would still have the same thing in the operation, And you didn't choose it, you chose this, right? And what happened after the surgery? How you feel now?
Now after the surgery, actually the second day of the surgery, I don't have any pain on the testicle, in the testicle. But I have the pain on the wound. Actually, it is the wound.
Wound, incision, cutting, of course, and the second time in the same place. So there was a pain to. And do you now? You can understand the pain. The pain is gone.
I'm very happy. The pain is gone, and also no pain in the wound actually. No pain in the wound. The testicle, no pain actually.
We dissected 30 centimeter vein from you. I was very surprised. But because in the Doppler I said it is like 20 centimeter, 15 centimeter, but there was a 30 centimeter vein inside.
Maybe it is twisted.
It's twisted, And here now when I look after the procedure immediately, there is only arteries pulsating, no vein. This is very nice.
Before it is vein actually when you come here.
And you can feel now it is gone.
Yeah, I feel calm when I go the second day. I feel only skin, no vein.
Was it causing any pain before the operation?
Before the operation, pain when I walk, when I stand for 1 hour, 2 hours. When I sit, I feel like hot in my testes.
And do you feel now it is different?
No, now it is different. No pain. I can like walk for long distance. No problem.
Actually, this is the best thing about the operation. It finishes immediately. Just after the procedure, people feel, there is no vein now. Sometimes, of course, maybe half of my patients are recurrent cases, persistent varicoceles. In some of them, it is not possible to dissect this long segment vein, but the procedure is really working very well. Taking out the veins gives immediate responses like you. Let me look at the wound now. Yeah, this is incision. We made the incision in the same place with the first incision. And your first incision was very nice, nicely healed, very small incision, smaller than this. But we say it is 2 centimeters, but it is like 3 centimeters because we have to take the testis out.
Deliver the testis.
Yeah. So delivering testis needs the size of the incision must be as half of the testicular size. So it must come out easily and it must go inside easily. So our incisions are a little larger than normal microsurgery incision, but it's better.
Actually, I'm not take care for the incision.
Yes,
I'm for the procedure actually.
Yes, and it is in the that region is always closed, so no problem. And your previous incision was nicely healed. Also, this seems after 4 days nicely healing. Inshallah, there will be no problem with this. Okay, I put this upside. This is a nice coverage. I put spray on it.
Okay.
This makes a biofilm cover for 2 days more. And still, I will put a watertight dressing so you can have shower.
Okay.
This watertight dressing, keep it for 2 days more, then you can remove it. So remove it after 2 days.
Okay.
You can take a shower with this, and the wound is nicely healed. Okay, now let's look at what we see before the operation. Here we saw that there was a big vein, 3.9 millimeters. So, and it has reflux. This reflux without strain. When you are in standing up position, there was reflux, and when you strain, the reflux was very prominent. And in the operation, here we see the large vessel here, and now we will dissect it. So when this is before delivery, just take the spermatic cord out, and always the external veins is the main problem, and it is very easy to dissect external. Internal vein, it's more complicated, but dissecting external vein is really easy. But the doctors, it is not written in the book to dissect it, so they are not doing it. But really, it's easy to see. Okay, here I see one of the external vessels is dyed. It's really occluded, nothing inside, but the other one is still here, patent. So it has recurrence. One of them died, one of them still here. Yeah, it's really interesting. There were 2 veins next to each other, and one of them disappeared. I can see the dead vein there. It's dead, it's empty.
And you take it out. Actually.
Yeah, of course. And the other one didn't disappear. It was full of blood. And I can see the ligation of the doctor. He ligated these veins, both of them. He did what he should do, what is taught us in the school, in our residency. We teach that we are taught like this. They teach us like this. Ligate them, leave them. But my experience, I understand that just ligating, sometimes, as in your case, the veins do not disappear themselves.
So what is the problem? It is not disappear even if
yeah, very good question.
Yeah.
Look, here the doctor ligated both of them here.
Yes.
But there are some connections with the gubernacular veins, other small veins. So these connections keeping the circulation continue. So if the circulation in the vessel stops, it will coagulate and it will disappear. So one of the veins disappeared. But the other vein has some connections with the other vascular structures, so the blood didn't stop. When it didn't stop, it didn't coagulate, and it was there, it didn't disappear. So when we take it out, it finished. Okay, now here we dissected look at a very large segment of vein. And there was another vein that was really shrinked with here testis is out when they ligated it. Is there any harmful effect? No. Now we are. People ask me very good question. Very large segment. I think it is, I think like 30 centimeters of vein. So this will disappear in conventional procedure. Now we are taking this out and
It's very long.
then we will look into internal stromatic veins. So let me cut it like this and look at this one. Very big.
My assistant Ali.
Yeah.
You call it Ali?
Yeah, Ali.
Ali.
Arabic.
We say Ali.
You know Arabic actually.
Yes, same. So, another question. People afraid of testis, what will happen? You take the testis out. But there are connections with the scrotal skin. We never dissect them. So it is still attached to scrotal skin. When we take the testis out, the scrotal skin comes together. Then when we pull scrotal skin back, testis go immediately to the old place. So we never mobilize the kidney, deattach the connections. It's still
Maybe think
go
that
there.
when you take it out, maybe twist or like this.
No, it's impossible because we just pull the skin back, it go back to the normal place. So of course you have to protect these connections. So sometimes my colleagues ask me, how do you take the testis out? I say, do not separate the connections with scrotal skin, because when you pull it out, pull it out the body, the connections have to come with them, and when you pull it back, it will go to the same place. So in the next video, let me see.
Okay. Now this is the internal vein. Actually, I was not expecting to find an internal vein. And this is, I will cut it now. This was really big.
This is an internal vein.
Yeah.
Okay, this is maybe,
Also this,
yeah, maybe 7 centimeters, 8 centimeters of internal vein. We also dissected this out.
I was not expecting any recurrence in the internal part,
Okay.
but still, this was also ligated. I see the ligation in the vessel. He ligated it, but again, it has some little connections with other branches, so it refills. And although it's ligated, it doesn't disappear. So I am now also taking them out as long segments. I don't want to leave any dilated vein behind. So I also do this and...
Okay, now we are making the control for artery. Now we are safe, we find the artery and we are sure that we saved the artery, we protected the artery. In this operation, part of the operation,
I do this control several times, maybe 3, 4, 5 times. When I start, before I begin, I see there is the artery, this part. So usually there are 2 or 3 arteries. I find the locations of them. Then during the operation, every time before make dissection in the vein, I control the artery. Then after the procedure, I make control. Then now in the Doppler, I see the blood vessels, so circulation is good.
How many arteries in my case?
Yeah, 3 arteries.
3 arteries.
Yeah, one of them is basal artery. It's very easy to save it. And 2 just next to beside the veins. Previously, I was having too much trouble in this dissecting, separating the artery and vein. Now I improved new techniques. Now it's very rare that I cannot take the vessel out, but it may happen. Sometimes they are stuck to each other. You can take the vessel out. So I put many clips or ligate in many parts. I want to disappear this long segment of vein. I don't want any residual large vein inside. So this is our technique, using this microscope, using this microvascular Doppler, taking out external vein, taking out internal vein. I am very happy that you feel the difference immediately.
Yeah, I feel the difference immediately when I...
Say once again, it's very nice to hear. How did you feel after the surgery?
After the surgery, immediately, second day of the surgery, when I go to the toilet, I touch the testis, scrotum of the testis. I don't feel like anything, only skin. I'm very happy. Before, I feel like crowded veins. And this make me like uncomfortable when I sit for like long hours. I feel like hot in my testes and get it down more easily.
And after your first operation, 2 years before, you feel the veins were still there?
Yeah, it is still there, and I make maybe 5 ultrasound, they say all this are you have recurrence, you have grade 3, grade 2 varicocele.
Yeah, that's why I improved this technique, because previously I was also saying it will disappear in 3 months, but I had the Doppler. So people come to me, doctor, please look, is it still there? I look, oh, it is still there. After 6 months they come again, please doctor, look. So I said something is wrong. We are not, because every urology doctor will say this will disappear in 3 months. Because patients are not coming back to this doctor when the veins are still there, so he thinks, okay, he healed.
Actually,
they are not healing.
I asked my doctor when he did the operation before 2 years, I asked him about the percentage of the successful surgery. He told me that from 0 to 3% only, the recurrence. Possibility of recurrence.
95% is said in the literature for microscopic surgery. So I was thinking like that. I am doing microscopic, the success is 95%. But when I had this Doppler, when I do control myself, I noticed that it is 70%. The real success rate is 70%. Doctors are not aware of this. They are not lying. They are not cheating. It's written in the book, if you operate with microscope, 95%. This is not true. In the original way, Cornell University defined how to do with microscope. They say you have to leave one artery and one lymphatic, cut everything. Everything.
Actually, I see that in YouTube. It is very dangerous, actually.
Actually dangerous, and if in your case they leave one artery, they would cut another artery. They would not know, and it is harmful.
Testicle will be atrophy, actually.
Atrophy. At least the testis volume will decrease. So this way of operation with microscope, cutting everything, just leaving one artery, one lymphatic, is nonsense. Is harmful. So actually, the way everyone is doing, they are just taking out the big veins and leaving the small veins they don't touch. But when you don't touch to these little veins, they are making communications with the residual vessel inside.
And it's large and large by time.
Yes, this doctor ligated it from here, but there's a residual vein inside. It has little connections with the other small veins, so the flow continues and the vein is not going away, disappearing. Yeah, it's very difficult to tell, but this technique works.
And
I'm happy you understand it and you can.
I follow you before 3 years actually. Before I do my first surgery, I say I will come, but I don't have like much money to come here.
It's not easy to come from Umman for this, but I am trying to keep it very low price. The cost is because in United States is $10,000.
Yeah, actually in my country like 4,000.
4,000. Yeah, it is less than half here.
on left side. Actually only 4,000. And I searched in my country the best center. Unfortunately, I didn't find any center that used microvascular doublers. Maybe like 4 center use microscope only. There
is, I think, one doctor in Egypt, and the other doctors are in the United States, and in Turkey 3 doctors we are using this. I first begin to use it, and I learned it from where? Do you know? I learned it from one of my patients. One of my patients said to me, "Hey doctor, are you using Doppler in the operation?" I said, "What? Is there such a thing?" He said, "Yes." And then I made a research. I find guys in Miami, this Doppler is used in brain surgeries. So we bring this Doppler, but there are a couple of doctors using it, and I think one of them is in Egypt. I am very happy we had a successful operation. Inshallah, this will work, and this will be last time you operate for this.
And it will be no varicocele in future.
Inshallah. And in the recovery, we will give you some medications, some painkillers, and some supplements to increase the sperm count. You are not married now. You don't need the sperm to go high
Actually,
and your sperm count is.
I did sperm count like 25 million in 1 millimeter.
This is good, but not enough. We want, after the procedure, we want a boost increase in the sperm, so we will give some medications, some supplements, and we will do the control with internet, with WhatsApp. If needed, you can come back, but we operated many cases from outside country, and they never need to come back again. We will see.
Okay, inshallah.
Thank you for coming. Thank you for everything.
Thank you.